Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
Welcome to the show. We have a very special co-host guest / mostly co-host who's filling in for the good Dr. Schulman. Welcome, Megan Earles.
Thank you. Good to see you.
That would be you. You're not really seeing me. You're seeing a digital projection of myself.
You look awfully familiar.
You did see me down the hallway just a little bit ago, so that was kind of cool.
True.
It was almost like real life again.
Almost.
But you happen to be our resident expert on trauma and therapy extraordinaire. And we're going to be diving deep into a couple trauma models, I guess, approaches, some of the tools that you use and some of the tools that as a practice we're trying to develop together. Mm-hmm. But what got you first interested, I guess, in wanting to help people in the way that you help heal others?
I was helped by people that helped me. And so along the way, I was a teenager and got into some therapy, and the rest was history. It's where I wanted to go. And so ended up in school for therapy to become a therapist. Started working with kids who had experienced severe trauma in Ohio right out of graduate school. And so it became really clear right out the gate for me that we needed to be educated and understand different modalities to be able to work with trauma, because the talk therapy wasn't enough. It was important, but it wasn't enough.
When did you realize that? Like, was there a certain patient or a certain process when you realized kind of the unique nature of trauma and what it's capable of doing? Like, do you remember having an aha moment, or is that something that gradually you learned to appreciate and respect more the effects on the mind, body, spirit that trauma or acute or chronic trauma can have?
I think it's been layered over the years. I don't think there was any one moment in particular. that very first job that I mentioned, during and out of graduate school, working with kids who had experienced severe trauma. We were in a school and their stuff was up all the time. They couldn't be maintained in a regular school. And so they were in a different school setting, a partial hospitalization school setting, and were having their symptoms were bubbling all over the place. And so as therapists working with these kiddos who were so incredibly dysregulated, but realizing what was beneath that sitting and talking with them wasn't going to be enough. Just skills training on how to regulate their emotions wasn't going to be enough.
What's so fascinating, especially about kids, which I don't work with kids, but in terms of biofeedback and trauma encoding and the whole concept of a trauma being physically stored in our body at a particular location or even a cellular level, it seems to me like kids don't hide their cards mm-hmm. as well as adults. Mm-hmm. The evidence is there if you really listen to them, watch their behaviors, watch their reflexes, watch their body. How much of your patient population is kids?
Right now, it's very little. It's evolved into, I'm mostly working with adults, and I have some older teenagers that I'm working with. But interestingly, the adults are the kid version of that trauma walking around. It's just a number of decades later, those patterns have ingrained. That trauma is stored oftentimes, if we're talking childhood trauma, at an early age, and continues to replay in those patterns in the way that it was encoded for decades sometimes.
So it's kind of like the earlier the trauma, the more encoded or enmeshed the effect it might have on the person who went through or is going through the trauma in determining or setting the tone for their life and the way that they interact with the world, whether they see the world as a dangerous place, as a threat, as another potential location for a trauma to be inflicted on them, kind of like a post-traumatic type of behavior. But that doesn't explain a lot of the unconscious or even preconscious traumas that I know is an area of interest for you.
Well, I think also it's happening when it's in childhood. It may not be a single incident. It may be cumulative over time. It may be the culture of a home, right? So it's day in, day out at varying different levels over the course of years. And those just aren't just any years. Those are formative years. Those are years that we're developing around. And so our psyche is developing around the presence of this energy of trauma. I kind of think of it like a tree. If you have a young tree and you tie a rope around it, the tree kind of grows around that, right? And that's what we see happen. People carry those patterns with them.
And they scab over, a trauma a little bit, but it never seems like it truly heals if it's left alone. We navigate around it. People bump into it every now and then, but what about trauma encoding itself? Help people understand what that is, what that means, what that represents. Why is trauma any different than any other psychiatric or psychological event that we see or treat, like depression or anxiety? Or
trauma is stored in a different place in the brain, encoded differently in the brain because of the heightened level of distress that we're in when it happens. It's not encoded or stored as an ordinary memory is. And so the challenge becomes, how do we access those memories in order to heal them? Ordinary talk therapy, as I said, is wonderful and is important to put words to that and to express it. But it's not always enough, because through just talk therapy, we're not going to access where it's stored. The $20,000 question is, where is it stored? How is it stored? What is stored?
Yeah, and we've talked on this show before about possible storage mechanisms for trauma. Mm-hmm. And there's probably multifactorial. Yes, there may or may not be a conscious memory of the trauma. Doesn't have to be. There may be a specific region of the body or the brain or the neural circuitry that was associated. If we're talking about, a sexual assault trauma, there may be a memory, there may be a repression, there may be that reactivation, there may be the guardedness. You may see a physiologic response or even a medical condition like vaginismus and things like that. That's very fascinating to me, that one single trauma, just to keep it simple, can encode itself on so many different layers, so many levels, probably all the way down to the soul level, not just, hey, this trauma is stored in my shoulder over here.
Or even DNA, looking at how that's encoded all the way down. Mm-hmm.
Yeah, on a cellular level. And then worse, there's evidence that traumas can form new memories, therefore generate neuropeptides, which then can integrate into our own DNA. And then that gets passed off to our progeny. So is there an unconscious log of traumatic events that happened to us before we had our kids that we passed on to our DNA? And it's really you can go down the rabbit hole for sure, but let's talk about some of the higher level concepts of trauma. In that, when a trauma occurs, there's a lot of specifics heightened. The amygdala gets involved. It turns on more primal parts of the brain. It turns off more modern parts of the brain. You're not thinking about doing your taxes when you're running from a bear, but it encodes everything that may be relevant or salient to that potential threat. So if it occurred on a cloudy day, maybe a cloudy day might reactivate or trigger you or something like that. It's that whole concept of state dependent learning.
Absolutely.
So what do we got to do to reactivate or reapproach that state, I guess, in a safe way? Because that's the area where a trauma therapist who's not as skilled as you can really cause problems and rip off that scab, and someone
people are wide open and buzzing beneath that. When I'm doing an intake with people, I'll ask often about flashbacks, and I would say 8 or 9 times out of 10, even if the person has experienced quite a bit of trauma, they deny having any kind of flashbacks, just at surface level. Because what are we shown culturally about what flashbacks are? It's what they show in the movies, right? Where we have the picture memory and we lose track of time and we've checked out. And sure, that's a very real type of flashback. But there are many other kinds of flashbacks as well. There's body flashbacks, there's emotional flashbacks, where we're having experiences that seem disproportional to whatever has triggered us in the here and now, that we're having a lot more anxiety or a lot more anger given compared to what's happening right now. And it may be that we're having old feelings or an old body reaction in the moment as well. And that's part of how the trauma was encoded. Something in the here and now activated it, triggered it, and then we're feeling that old stuff at the same moment too. But we may not have the conscious awareness that oh, this is connected to 20 years ago when whatever happened.
Yeah, and that kind of has to do with things like repression, because if repression is kind of this exclusion of what I would call ego dystonic. Let's say that basically just means uncomfortable to think about. Mm-hmm. But it's an exclusion of uncomfortable thoughts, feelings, or memories, really, that is a adaptive mechanism to protect the brain and the psyche from becoming overloaded with the trauma, or not allow access to the trauma in a place in which we're not sure if it's safe to revisit the trauma because the threat still feels like it's out there. So I think repression is considered a healthy. Is that a healthy?
Trauma by definition is something that overwhelms our capacity to cope. So you and I may go through the exact same thing and it's traumatic to you, but it's not to me. It's not so much about what happens as right. how we experience it. Well, we experience it as being overwhelmed. So what does our brain do to help us to survive, help us to cope with that? It fragments or it pulls away from the intensity of it. We pull back. If that's a hot stove, what do we reflexively do? I pull back to protect myself, and our brain kind of does the same thing, pulls back. That may be a dissociation that happens, that may be a repression that happens. It's just a pulling away. So then we see people that come in the door and they may be fragmented. They may not have conscious awareness or a fullness of their memory experience that's readily accessible to them. And so part of the healing is really about putting back together the pieces of that puzzle and integrating, having one whole memory as much as we can, and then changing the what I call the vibration of it, right? Changing how that's encoded in the brain or the body.
Well, so that's really fascinating in terms of the treatment. I'm still kind of thinking of the, psychic pathophysiology, if you would, because you can get fragmentation. Repression, I think people tend to generally understand. And then repressed memories may come out later spontaneously. They may come out 20, 30 years later. They may come out when you're in a safe place and you've pulled over the car and you have a minute to relax and decompress. But most people, I think, understand that concept. The fragmentation and integration, I don't think most people understand that that's what we do. And it could lead all the way to depersonalization and dissociation. Even out-of-body experiences, some people have been launched into such a dissociative state that they have what would be considered like a near-death experience, except they would not necessarily be near death. That fragmentation occurs on many levels. It's not just the fragmentation of the self or the ego or your psyche. We've talked about soul fragmentation on this show before with Alyssa Benson, and that concept of part of your spirit actually being stuck and locked in the past, in the memory of the trauma or the
body memories could be a fragment as well, where all of a sudden this part of my body, it starts to hurt. And where is that coming from? That's not related to something that's going on in the here and now. Or I jump into a place where I'm super angry, right? Or I'm jumping into a place where I'm super depressed, and underneath that is trauma memory, right? But it's different parts of the experience. It's like taking a jigsaw puzzle, and separating the pieces, right? So that, because looking at it all at once is too overwhelming, and so the pieces are separated out. But that can make life chaotic if we're living in that kind of place. And life may not seem like it makes as much sense because I'm having intense emotions of anger over here, intense emotions of depression over here. My leg is hurting, whatever that may be.
And what's cool about the concept of integration is it's using tools and techniques, a lot of which a lot of which we're kind of developing for the Mind Body Center of Florida, which may involve 1, 2, maybe even 3 different practitioners to help to reintegrate the fragmented parts of self or soul, or ego even. And how do you do that in a safe way? How do you do that in a safe place where you're reintegrating these discordant parts of self, if you will? I can only compare it to like desensitization or flooding or something like that.
I think it's about seeking to find, again, I'm going to use that word, the vibration of what each of those puzzle pieces, as we're talking about, might feel like, right? So if you go back to your high school and you haven't been in your high school for 20 years, when you walk in there, it might feel familiar, right? There's a certain feeling. You might have some memory that comes up cognitively.
Yeah.
You might have some emotion that comes up. It might just kind of have a feeling to it. That's what I would refer to collectively as the vibration, right? So you walk in there and there's the vibration of what this high school brought up for you. So what we're doing, or if you hear a song, the same kind of thing, or you smell a smell, why is that? Because when we are experiencing something, as you said, it's encoded into memory based on all the stimuli that's around. And that could be external stimuli or whatever we're experiencing internally. So it's the concept of state dependent learning, where the state that we're in is where we've learned it, where we've encoded it. So if we can re-access that, then we're able to heal it. If we're able to re-access the state that we were in during a trauma in a safe way, right, in a way that doesn't become flooding, then we're able to give ourselves a new experience, a healing, soothed experience, so then it doesn't have to stay stuck. Does that make sense?
Yeah, no, that makes perfect sense. That's very well put. I would take it even a step further, because like with Alyssa Benson, for instance, you know, we did the show on past life regression and soul trauma healing. This is one of the things that she talked about, was actually soul fragments and reintegrating soul fragments. So I think there's many layers of integration. But interestingly, vibration seems to set the tone to tie them all together. And I think that's a little bit of a mystery of the universe, that how and why it does that.
It's patterns of familiarity, right? This is the state that I was in. This is how things were in my life, or in
like
that
the
moment.
Resonance, right?
Exactly.
Yeah.
I mean, we use phrases like, does that resonate with you? Did that ring a bell, right? How does that strike you? What are we talking about? We're talking about how does this vibrate with us, right? That idea of what does it feel like in our being? Not necessarily just an emotion. It might be not necessarily just a thought or a body sensation, but the collective whole of all of those things. So the $20,000 question becomes, in healing trauma, how do we get to the vibration beneath that memory? Talking about it's just going to keep us up here. That's not full enough. That's not complete enough, which is why people will say, I just spoke with people this morning that were saying, I've been to lots of other therapy, I've talked a lot about it, I'm not feeling better. Okay, that makes sense, because they're hanging out up here and we need to go to that deeper level. There's a multitude of tools that we can use to go to that deeper level, but underneath it, it's about accessing what is that vibration and what do we want to do with it. We want to kind of hang out with it, feel it, give it expression, and then we want to soothe it and repair it. I think of it like with my 3-year-old falls and skins his knee. Ouch, he's hurting. He runs over to me and he needs to be held. He needs to be with that pain for a little bit, but he also needs to be soothed in that pain. And then this really interesting thing happens after a minute or two. He kind of like gets up and walks away, wipes his tears away, even though it might still be stinging. It doesn't hurt as much because he had that reparative experience while being in the pain. So it's about having both at the same time, the vibration of the pain and the vibration of the soothing together.
So yeah, there's the vibrational piece, and then also the nurturing and that support. Of course, like you said, there's a multitude of tools, but ultimately the goal is to take the fangs out of what's stinging you, what's trapped, in order to facilitate the impasse. The rut that you're stuck in with a trauma is very classic, nightmares, flashbacks, re-experiencing, avoiding behaviors. All of that are sort of outcomes of how we react to a trauma that tells us very little about how we integrated it, how we processed it at the time, and how we understand it, existentially.
Right, absolutely. We're able to tolerate being with the memory as a whole when the fangs are taken out of it, right? So fragmentation, remember, serves a purpose to help us to cope and to not be overwhelmed. So if we can get to the parts of those memories and soothe them, ease them through these variety of different tools that we have, then we are more able to tolerate all the different parts of the memory coming together at once. We don't need to live separated.
I think what's so amazing with the work that you do, and Sam, all of them, Nicole, Dr. Schulman, is that you safely and supportively go in there. You locate where someone's fragmented, or what the sort of the sequela of the trauma caused. Look for the earliest, deepest layer of it, and kind of start to unpack that, because the trauma itself has overwhelmed our capacity to cope. You may break into different fragments, and you have to identify the fragments, number one, which is hard in and of itself for a lot of people. That's why it's so amazing what you guys are doing. But when the fragments happened, they might not have all happened at the same time. In other words, you might have fragmented at age 6 on this issue, and then you might have a fragment at age 12 on another issue. So it gets kind of like this a little accounting clerical error or nightmare, where you're having to identify the fragments when they split off, and then find out what each fragment needs, because the 5-year-old fragment might need, just unconditional love, nurturing, acceptance, being told this wasn't your fault, sitting into that pain, like you said, all the tools, whereas the 12-year-old fragment might need something completely different. So it's kind of amazing that you all are able to identify the fragments when they split off, and then know what to do about it, to take the fangs apart and then reintegrate them across time and space, really. It
sounds infinitely complex, because it is, but where I get centered on it, because it can be easy to become overwhelmed in all that you're saying in that way, is looking for the patterns, right? And so the patterns that are beneath it. So if we tap into a pattern of, or a vibration of depression and sadness, or feeling trapped or powerless, or some other component of trauma, then what we find is that off that same thread, if you will, may be several different memories. And then once we go there, we're able to soothe whatever that thread needed.
I like thinking of them as threads. Life experiences are kind of threads of the tapestry that ultimately puts together our life. And there may be traumas, there may be ugly threads and things that we wish that we could, trim or pluck or delete or remove or repair. But they're integral. They're integral to the tapestry of life. So if we pull on one, the whole thing really can unravel. So the integration is an important message, I think, for people to understand that, you're not trying to make them brainwashed into never caring that they lost a child or something like that. You want to get them to a point of healing, where when they think of their lost child, a smile comes to their face before a tear. That was one definition of healing that I heard. and the capacity that you guys as providers have has been amazing to watch. It's been amazing in the response of patients. It's been amazing in just me viewing how much you're able to help and get through to people that our models haven't been working.
Well, thank you. I think it's a privilege to be able to be with people in the depths of their pain, right? And to be in the position to be able to give soothing and support while they're hurting, which really is what ultimately is what we all need, right? Like the 3-year-old coming to me, right?
Yep.
We just need love and soothing while we're hurting, and it helps to transform the pain. Something about that love and that soothing being added into the mix allows the vibration to
changes the frequency. Yeah,
changes the frequency of it. And really, I think what it does is it allows us to relax into it. And yeah, the stuff may bubble up and out, but we have support in that. And then our whole being, mind, body, and soul, is able to begin to move through life in a more relaxed kind of way, so that then we are open. We're not gripped down, protecting ourselves and holding it in or avoiding. We're able to walk through life, with open hands, so to speak, ready to receive the goodness of things and feel the joy and absorb the goodness that's around us without being in that self-protective pain held place.
Yeah, and where you're just in status panicus, you're waiting for the axe to fall, you're catastrophizing, you're kind of in this like emotional defense all the time, the hypervigilance, and it's extremely exhausting. It will lead to all kinds of problems, from depression to even panic attacks and substance abuse. And I think everyone has had some trauma of some degree at some point in their life. And it's an important topic to talk about, because some that you see are quite horrific. Mm-hmm. Some are unspeakably horrific, what people are able to endure. And it's through work like this that you're able to identify fragments, chip away at it, and then know the tool set that you have, where to apply what, when. That's the art, I think, in what you do.
Absolutely.
But there's another piece that I got to ask you about that I think is the most fascinating part of all, in terms of accessing the state of consciousness of the central nervous system itself, where it was encoded. So let's say centrally, cellularly, even somewhere else in the body versus an astral body or on a soul level, however you want to think about it. And that's that idea of primitive reflexes. Mm-hmm. And we could dovetail into sacred geometry a little bit with that, but tell me about primitive reflexes and how they can be used in the clinical practice to access these states or to discover them, because the person may have repressed and not realized that they're fragmented.
So when we're talking about that idea of state-dependent learning, what state was I in when I learned this, or when I encoded this, or when I experienced this? Was that country music song on? Were chocolate chip cookies cooking in the other room? These kinds of things are where will help us to activate it. That's where some of the memory is. If I go boo, you go, right? Reflexively. Yes, reflexively.
We didn't even rehearse that.
We didn't. Good job. You picked right up on it. I go boo, you go. Your nervous system, when the boo happened, when the trauma happened, is in this state. And so we started to think about this, and we thought, okay, so we're doing these therapy sessions and we're talking about memories, or maybe using EMDR or some of our other modalities to be able to get to that deeper level. But what was the state that we were in? Kind of like the song that was on, these kinds of things. What was the state that our central nervous system was in? It was in fight or flight or freeze, right? And we started to explore the idea of primitive reflexes. What are those? Those are the first reflexes that we're born with, or actually before we're born, that are developed in utero. I mean, within weeks of conception, these are the very first kinds of protective reflexes that are born.
Instinctual, right?
Absolutely.
I mean, they're truly instinctual.
Completely automatic, instinctual, self-protective kinds of things.
So all of us have it.
We all have it.
Okay.
And then they're supposed to kind of resolve over time, right? So they're not real intrusive. If you have a baby and the baby gets started, what's the baby do? It does this, and then it comes in. Well, this is actually a reflex from the nervous system, right? That it's kind of like the fight or flight. It's saying this is called the moral reflex. It opens up, and oh my gosh, right? Well, we were thinking about this with trauma. If I go boo and my nervous system is startled, how do we access that state of our nervous system? Because if we could get there, could we help clear out and access the trauma that's stored there, right? So I kind of think of it like a slinky, the reflex that goes, slinky goes open, close, right? What we're learning to do through some unique ways of working with the body are kind of like expanding that slinky and noticing, oh, when my nervous system was in this state, this thing happened and this thing happened and this thing, and that was the fight or flight activation that I was in. So how do we repair it and soothe it, like we were talking about, while we're there, right? But it's hard because it goes like this. What we're finding is there's some motor pathways and some specific movements that we can do to access those reflexes. Those reflexes won't integrate, there's that word, or won't go away until they are cleared. If we've gone through trauma, they can stay active, and that's maladaptive. We don't want to walk around life being overly startled and those kinds of things.
So is that kind of the theory behind why tapping works, or EMDR? How does that fit into reflexes, if at all?
Well, I think with the bilateral stimulation, we're activating both sides of our brain, right? So that is a little bit different from where the reflex is. The reflex is stored in the activation place of our central nervous system. The bilateral stimulation helps to access it in a different kind of way and move it through and clear it. When we're using the reflexes, we're saying, what's there? Right? Your body went like this when I said boo. So how do we safely get somebody to be like this so that we can clear out what's there? And the eye movements, the bilateral, stimulation, those kinds of things will help, the body therapies, but it's about getting into it, finding what's in there. The fear paralysis reflex is another one. That's actually the very first one that develops in utero. And what that is it's the pulling back. It's that freeze response, the pulling back. And so we think about all the people that we see that come in they're like this, right? That are walking around life guarded, and their bodies are gripped down. And I believe they're gripped down all the way to a cellular level, gripping down, protecting, stuck in this reflex of self-protection. So we began thinking about, how do we access that reflex? How can we get in there and help soothe the reflex without maybe even having to go through every single memory, but looking at the common thread as being, oh, this was the state the body was in when those things happened.
Does it work?
Yes.
I mean, that was a loaded question. I already know the answer to this. I'm blown away by how well it works. But in your clinical experience, why aren't other therapists doing this? Or are they, but to a lesser degree or a different approach? Like, how does this compare to other trauma-based, trauma center focused, rapid resolution, all of these other trauma design suited therapeutic modalities? Why is this working so much better?
I think that when we look at all those different modalities, we're looking at what's the common thread. They are all different tools to get in, right? To get into the stuff. And then what do we do once we're in? How do we soothe it? How do we change that vibration to heal it? And there's a number of different incredibly effective tools to doing that, right? But something about this idea of the body work with the reflexes in particular has allowed us to access that activated central nervous system in a brand new way, that we're not sure, that we're not finding other people that are using it in a therapy setting in this kind of way in particular. Lots of occupational therapists are doing it with kids, are doing it to help integrate the reflexes, yet it's very, very commonplace. But we're using it in the therapy session to be able to access trauma, and then have the therapist there, the psychotherapist there right then live time to work with what comes up and out of it.
And do you use like the sacred bowls in some of your sessions? And is that part of the vibrational healing?
Yeah, the singing bowls, right? So and they have different tones. So sometimes we'll be working with somebody and we're talking about a memory, have access to memory, and then what we do is we find a tone that resonates with them. There's that phrase again. Does this resonate with you? Right? We use that in just our day-to-day language. What tone kind of feels like what you feel like inside? Right? So finding the one that resonates with you. And then what we may do is we may pair another one that we seem to be able to find another one that soothes. So it may be that a C sharp over here resonates with a bowl that's of a C sharp vibration, resonates with the pain that I'm feeling from whatever I experienced. But then we find that some other tone may harmonize with it and help to soothe. And so then what have we done? Like the 3-year-old on my lap, we're sitting in the pain, the vibration of the pain, and then we're also sitting in the vibration of the soothing at the same time.
So by doing that concurrently, you attenuate the teeth, you attenuate the pain of the trauma, which opens it back up for that energy and thought and to move through.
It changes the vibration of the memory so that we can be with the memory, right? All the way through mind, body, soul. And it doesn't have the same fangs like you're talking about. I like to say it changes the vibrational signature of it, that the vibration is different from then moving on so that our body doesn't need to, or all of our being doesn't need to remain gripped and blocked and protecting. I mean, that's the nature of post-traumatic stress. Is it's an intrusion of a vibration that's replaying and trying to block and protect and not experience it over and over and over again.
Why do you think a trauma replays? Is it kind of like an earworm, like Luai, or one of the more modern earworms that gets stuck in your head? Is a trauma just not know how to get processed, fixed, stuffed, and then therefore it's kind of like a running program in our unconscious, often for decades?
I think it needs a release. Yeah, I kind of think of it like a kinked hose, right? So there's this energy that's moving through that it's trying to move through, but if it's kinked, it builds up this pressure, and that pressure continues and pulsates, which we could say is the vibration, right? That the experience of the trauma, it pulsates until we can let it move through.
What is so cool and fascinating about this is this type of trauma, it shows how we've talked about how it encodes, but how the interventions have to be at the same level as the energetics of the trauma, and why cognitive behavioral therapy and interpersonal and dialectical and Gestalt and some of the more classic or evidence-based even therapies aren't able to get deep enough to that level because they're just too conscious. They're not looking at the encoding in the body. They're not looking at these primal reflex or primitive reflexes. They're not looking at the vibrations. They're not looking at biofeedback, so some work with Sam. They're not working with intuition. They're missing the boat. You could be doing conventional therapy for years and not get the results that just a couple of sessions with the mind body center is able to not only access, but start to take the fangs out and start the healing process. To me, it's a breakthrough. It's a breakthrough of unlike anything I've seen in my career in terms of therapy. It works. It's safe. We've got great people that are doing it. And I think we're more traumatized as a culture than ever. And people are recognizing something's wrong with them, and they don't know where to turn. They don't know what to do. They've tried various things. They may have tried conventional therapy. They may have tried medications and conventional psychiatry, and they may have tried distraction and overworking and turning to drugs and alcohol, but they're not getting better because the end behavior is the way we act now. We scream at each other, road rage, I can't say that on YouTube, but violence, the Karens, the primitive coping skills, right? This black and white thinking.
Stuff. Yeah, that trap stuff. And Dr. Schulman's emotional shifting process is really what began all of this for us, right? So he laid this foundation with this brilliant process of having the body therapist in the room with the psychotherapist simultaneously. And that's where so many breakthroughs are happening. Now we're taking that and we're just expanding on that and saying, okay, how do we use reflexes in that? Maybe how do we bring neurofeedback or acupuncture into the room with that? How do we take it further? Those more traditional therapies, like you were talking about, DBT, CBT, even EMDR, that'll take it to the next level. That'll start accessing the brain and getting to a different level. But it wasn't going deep enough, right? It wasn't accessing what was stored in the body and giving release to what was stored in the body with enough oomph, enough clearing, and it wasn't seeming to get to that felt sense, that vibration at the deepest level that we needed it to be.
Well, we could talk forever on this. This is a fascinating topic. It's kind of an ongoing thing that we as practitioners have been honing, I'd say, over the last 6 months, and certainly the next 6 months amongst ourselves, and working on our experimenting on our own psyches in that regard, to really hone this process and to find out what's going to be the most personalized approach for each patient, to give the safest, fastest, and most complete path to wellness. So I could talk to you all day, forever. Of course, you are my soul sister since we're born on the same day.
True.
But we might have you back for a part 2. I know that there's a lot more here. And as we develop this, I think it'd be good to give viewers updates on this. But if you want to check out Megan's website, I'm going to put it in the description below. And please leave us kind feedback, comments, questions, anything helpful, topics that you'd like to hear. Megan's just down the hall from me, so we'll put our heads together and answer some questions and develop some more shows. But our next guest, did you know this, Megan? In 2 weeks, we're going to have the good Dr. Lawrence.
Awesome. I did not.
Author of Melatonin, the Miracle Molecule, which awesome. I'm super excited about. This is an area I'm learning a lot about, because melatonin does all kinds of things beyond sleep and for our immune system and fighting infections and degenerative diseases, neurologic processes, depression, autoimmune, aging, cardiovascular health, and even treating cancer.
It's one of those common threads beneath the surface that, like we're talking about, that seems to be our theme here, is to find the common threads.
I like it. So join us in 2 weeks for the sit down, co-host Dr. Lawrence, and thanks again, Megan. This was fun.
Thank you. It was fun.
Until next time, be well.
Be well. Thank you.
I like that. I'm out.